This short video is on the rehabilitation of knee meniscus injury. We will aim to keep this video as short as possible, but without compromising on vital information. If you are watching this for the second time, then you might want to skip past the short theory section and go straight to the rehabilitation and exercises advice. The exercises are grouped into two sections: the stretching or mobilizing and strengthening. If you have a medical condition, we advise you to consult your physician first. Spiros, we're going to talk about knee pain, and in particular the type of knee pain that is emanating from an injury to the meniscus. Can you tell us a bit about the meniscus?
So the meniscus, or plural menisci, are you have two in each knee, the lateral or outside aspect, as well as the medial or inside aspect. They're two sort of C-shaped cartilaginous rings. They act partially as a bit of a shock absorber to transmit forces when we're walking or running, jumping, as well as acting as a way to kind of deepen the, serving as like a cup, so to speak, for the femur to articulate on the tibia below. So our thigh bone and our lower leg bone.
So what sort of events, what sort of pathologies might lead to a damage to the meniscus, whether it's acute or chronic, please?
As you just said, the two things we are considering would be either acute or chronic. So starting with acute, we are thinking of a sudden trauma. Now that can come from a sudden directional change with our feet fixed to the ground as we twist with a bent knee. Very commonly it would occur as a result of a tackle in sports, or if something goes into the side of you. So what we'd be thinking is, again, fixed foot in the ground, a rotation, and a kind of caving in or a valgus force causing a tear to the meniscus. We do know that when we have the medial collateral ligament, this ligament in the inside of the knee, it has direct connections into that.
Tell us a bit about the chronic manifestations of meniscal injury.
So chronic manifestation of a meniscus injury is probably going to arise as a result of poor biomechanics over time. We're talking sort of months, years. This can result following a specific injury to another unrelated area, causing you to adjust how you walk, how you load the joint. There could be a genetic component, as well as certain things in our lifestyle that might have influenced more wear on the joints, such as carrying a bit more weight, working certain occupations that place a lot of demand on the knee.
Being overweight is a huge factor, so that's something that should aim clients should aim to reduce as much as possible. Yeah.
So going on from there.
For chronic
going on from there, if we have an injury to the meniscus, it's very important to assess the degree of the injury. What are the implications of that? Are we having locking of the joints? Is the pain persistent?
If there is this locking, and some of our clients do report locking and swelling of the knee, then what would be the advice in this case?
Well, if there is locking, it's important to know when is this locking occurring, at what point is the knee in a flexed and open position, is it extended and closed, or trying to extend and close? How often is it happening? Are there things that kind of trigger that? And provided they don't, those things, it settles down. But more importantly is it's just very important to have it assessed to know what extent of damage there is, as there is a correlation between injured meniscus and osteoarthritis down the line.
Yeah, we don't want that. Great. So now, let's say you have a patient that you are treating and you're advising on a rehabilitation and exercise program. What sort of useful things would you start with? Simple things.
So as long as pain is not going to be a limiting factor, we want to focus on keeping the knees or getting the knees nice and strong. So we want good range of motion, good strength, good control. Also, not just at the knees, but at the hips. Because again, if we have weakness in our hips, then we're going to have a huge impact on how we're loading that joint.
That's an enemy. Weakness is definitely something that's going to predispose you to more damage. So let's see some exercises.
Okay, so the first thing is just taking a nice stable dining room chair. We're just going to hold on to this just for a bit of assistance, and we're going to explore the range of motion we have by performing a little bit of a squat. So sit back down, good. And as you can see, Matthew has quite good range of motion. His menisci are in good shape, but don't expect to necessarily have this range of motion yourself. You might get to around this point, or if you just come up a little bit higher up, Matthew, so if just do a quarter squat, this might be all the range of motion you have at the moment. If you do, that's fine. We're going to just gradually try and do a few repetitions of squats in this position to build up strength, kind of help lubricate the area, so to speak, and just gradually see if we can sink into a little bit more range. If this feels like range is a limiting factor, but strength is not, then you can make it a little bit harder by standing just on one leg. And we're now essentially effectively doing a single leg squat. And this is going to sort of double the work that the leg in contact with the ground has to do. Once again, just exploring the range of motion you have and gradually trying to progress that. The next exercise we can do to promote strength in the area is called a wall sit or a wall squat. So if I could just have you lean against the wall so your back and shoulders are in contact with it, and just get down into a seated position. But you can do this in an isometric fashion, which means you're just staying in position without kind of moving up or down. Once we've gone through our squats and our isometric wall squat holds, we want to start incorporating a bit of balance into what we do. So to do this, it's simply just standing on one leg. One that feels very, very easy. You can make it a little bit harder by just softening the knees slightly and closing your eyes. That takes away that kind of visual anchor that you might have to fixate where you're balancing. Of course, do make sure you're doing this in a nice open space where there's no hard objects for you to fall and knock your head on. Ideally, having something in front of you that you can hold on. When that becomes very easy, you can progress that by just letting your hands come out in front of you and just gradually letting them rotate to the right and to the left. Let yourself come down, let one leg go backwards. And then when you come back up, I want you to focus on driving from the glutes. Good. And repeat that motion. And come back up. So this next exercise, again, is to improve range of motion in our leg, in our knee. What we're going to be focusing on is our end range extension. What I'd like you to do, Matthew, is if you were to bring this heel towards your bottom, what I want you to do is just let your heel slide along the mat and really squeeze that quadricep at the bottom. So just straighten it. Good. It's almost imagine you're trying to squash your knee down against the mat. So the next exercise I'd like to go through are just called knee extensions. So this is being done purely with your own body weight as resistance and gravity. What I'd like you to do is just fully straighten your right leg for me. Good. Bring your toes back and almost turn them out slightly. You should feel a nice intense contraction in the quadriceps, including that sort of medial aspect, the vastus medialis obliquus, or innermost portion of the quadriceps. So again, we would do between 10 to 20 repetitions of this, having a nice squeeze, or 1 to 2 second hold at the top, really squeezing, coming back down. Once this is feeling very, very easy, we can start utilizing a band to apply some resistance. Okay, and then you're just doing a leg extension. Good. So again, this is adding some resistance. If you do have access to a gym and to one of the leg extension machines, that is absolutely fine to use. Another progression to the knee extensions with just gravity as a resistance or with a band as a resistance is using something like an ankle weight, which we can strap onto our leg. So what I'm going to do, Matthew, is just place this around your leg, feeding the Velcro through the loop. So once again, Matthew, if I could have you doing the leg extension. So excellent. And this kind of added weight at the end of our limb is going to provide a bit of resistance to our... There's a slightly different strength curve, meaning that when we're perpendicular to gravity, you've got maximum resistance here, whereas with the band, the further you go, the strength curve changes. You can actually pair the two of these together as a little home progression as well. So the combination of the band and the weight is going to be harder than just one or the other. So the next exercise I'd like to show is called TKE, or terminal knee extension. What I'm going to have you do, Matthew, in the interest of comfort, I'm going to have you just hold this behind your leg and just get you to step through the band. So we're putting this just above the knee joint, so it's not digging in or cutting in, sorry. This towel purely is here for comfort. If you're doing this at home, you could have longer trousers on. What I'm going to have you do is almost just take a slight step backwards with the unbanded leg and just let that knee bend. Now, with your weight on this leg, I want you to fully straighten it out. Good. So you're contracting, you're extending the knee, the band wants to pull you forwards, and you're using the activation of your quadriceps to really pull that back. A way of progressing this is by just letting yourself go back a little bit further, thus putting more tension on the band. Alternatively, using stronger bands is another way of progressing this. And once again, if you're at a gym, you can anchor the band to something like a squat rack and really put quite a lot of tension on it. So a progression to the heel slides, which we were just demonstrating, would be a banded heel slide. So in this case, the elastic band is going to act as resistance. So what I'd like you to do is just let the leg bend as you did before with the heel slide. Just get this out of the way to avoid any distractions. Good. And then you're going to straighten your leg against the resistance of the elastic. Good. Before you sit back onto your heels, we're just going to put this into the crease behind your knee. So if you get that into position, good. And then you're just going to sit back, just make sure you get that towel nice and deep into the crease behind your knee. Good. And just kind of sit back onto it. So what this towel is doing is serving as a kind of fulcrum or a hinge point to gap the joint as Matthew sits back. In this position, again, you can just hold it for anywhere from 30 to 60 seconds. You can sort of gently kind of pulse backwards. Just feel a bit of a traction effect. And once again, it shouldn't be painful. If you're feeling any pain, then just don't put quite so much pressure on. So the next thing, once we feel like we've got a bit more control and coordination and balance and strength in our knees, we're going to start progressing the demands on the joint, on the muscles. What I'd like to do now is a lunge. So what I'd like you to do is get into a split stance. We're going to make it a little bit less dynamic. Rather than sort of lunging forwards, in and backwards, we're just going to simply go down. So bringing that back knee down towards the ground and coming back up. Good. So I really want you to be focusing on putting more of the weight on your front leg and really using that back leg mostly for just a bit of assistance and balance. Good. And come back up. Again, you'd be aiming to complete around 10 to 12 or so repetitions. If you're finding it extremely easy, we'll talk about some progressions in the next step. Excellent. So if this feels too easy, what we can do is add some weights to the exercise. So in this case, I've got 2 5-kilo dumbbells. Another alternative is just putting some books or bottles of water in a backpack and wearing that if you don't have dumbbells at your house. And again, the weight here, really the purpose is to cause Matthew to start fatiguing within that sort of 10 to 12 rep range. If he's getting to rep number 12 and feeling like he could do another 10 or 20, then it's not loaded enough for him. If he's finding that he's struggling to get even to 8, then we need to deload that exercise. We're going to introduce a wobble board. So it's a board with a grippy surface on top where the foot would go and a small point of contact below, which is slightly convex. What I'm going to have you do, Matthew, is just put one of your legs right in the middle of that dot on the wobble board, and you're just going to do the lunges as you did before. Now, I want you to try and focus keeping everything as steady as possible. If you were to just exaggerate what would happen if you had very poor balance, you would sort of see the board moving all over the place. And that's fine if that is how it feels to begin with. Everyone's going to start at a different point. Due to the injury that they have sustained at their knee, they might have less kind of proprioception or sense of where the body is in space. This is something that's going to quite effectively train that. So again, make sure you calibrate at the top of each rep if you need a moment to gather yourself. And again, goal perform 10 to 12 repetitions, finding it quite fatiguing. You might find that in this instance, you're actually feeling your lower leg and some of the muscles around the foot start working a bit more, becoming a bit more active than they were when you were just doing the conventional lunges. So this is just a nice effective quadriceps and hip flexor stretch. So in order to do this, what I'm going to have you do is get into a slight lunge position, put your back foot up on the couch, and we're just going to drop this knee down towards the ground. Now I'm just popping a cushion here to reduce pressure on the knee. What I want you to focus on is, if you want, you can just walk that foot forward a little bit more. And I want you to focus on kind of just bringing your hips forwards. I don't want you to try and extend through your lower back, giving you the impression that you're actually lunging further in, but the whole kind of pelvis travels forward, and you probably already might feel quite an intense stretch, either up here close to the hip flexor or there throughout the quadriceps. If you feel like you want to feel more in the quadriceps, what you can do is just bring yourself back a little bit closer to this footrest. So you might actually need to slide your knee back, so we're effectively closing that space. And once again, try not to overextend at the low back and just bring your hips forwards. You probably feel quite an intense stretch right there. So in that position, if you need to rest your hands on your front leg to try and help relax the body, our bodies tend to stretch better when we're as relaxed as we can be. In this position, take some nice deep breaths in.
Thank you very much. That was really useful. Lots of useful exercises for knee rehabilitation. Finally, what sort of additional advice would you give to someone who is progressing on from the exercises?
Okay, so if they're progressing and things are improving, then I always like to apply the concept of progressive overload, keep making it challenging to the point that we're getting back to some semblance of the activity that we want to return to. Our rehab needs to meet the demands of what it is, whether that just be the demands of office life or going up and down some stairs, or the demands of being back on the sports field and playing your sport. If you are not progressing the way you expect, if you are still experiencing problems, then it is very crucial that you do get this examined. We want to make sure that we know the extent of the damage, how it is affecting you, how it's affecting your joints, make sure we have the best management possible. As I said, there is a correlation between meniscal injuries and osteoarthritis occurring later in life. We want to make sure that through a combination of diagnostic imaging, such as an MRI typically, we know where the tear is, what type of tear it is, how to a greater degree it's torn.
What's your opinion on support? If you go on the websites, on the physio websites, there is hundreds of different types of support. Is there a scope for wearing something like that?
So these supports do provide an enhanced proprioceptive awareness. What that means is a sense of, it brings our attention to our knee. When we have something on there, we're a bit more aware of how we're using it, what position it's in, how we're loading it. That has a place. Most supports, unless they're sort of like a rigid metal bracket, they're not actually providing stability. They're just kind of enhancing our awareness of where our joint is. For that purpose, I do think there is a benefit in them, but it's by no means a protective kind of structure.
And some of them might be more specialized devices following surgery, reconstruction.
Absolutely, and that would be discussed with the individual by their orthopaedist, and we go from there. There is something to be said for a little bit of a compression support to minimize any excessive swelling. Inflammation will cause a bit of swelling in that knee. You might notice, especially after more of an acute meniscus injury, that your knee really does kind of puff up and balloon up quite substantially. Again, that's all part of the normal healing process. We don't want to completely inhibit that. But if it's so swollen, it will affect the way we move. Absolutely. So rest, elevation, let that settle down.
And if in doubt, go and see your specialist again. Lovely. Great. Thank you very much again, Matthew. Thank you very much, Spiros, for this. That was very useful. Thank you.